So I'm Steve Cox. I'm a physician assistant, independent physician assistant here in Utah. There's a handful of states that allow for independent physician assistants, like nurse practitioners, to practice independently. That's what I do in Utah. I'm also licensed in Hawaii and Idaho. My background really is in orthopedics. So my specialties in orthopedics, injections, and regenerative medicine. And so I got right into orthopedic surgery out of PA school. I did that for almost a decade in Washington State, about 6.5 years in Washington State, and another 3.5 years here in Utah. And orthopedic surgery is great. I mean, I miss it sometimes, but it's pretty hectic, a little stressful. So I had to get out of that at some point. But that's where I started using regenerative medicine, was with a surgeon that I was working with here in Cottonwood Heights. We were using stem cells and regenerative medicine on our D1 and professional athletes that we were doing surgery on, because they need to get back to playing, right? Instead of 6 to 9 month recovery on an ACL, we could get them back in like 4 months, with stem cells afterwards. And so we were using that. It was working great. We started using regenerative medicine and stem cells for some of our patients that were not good candidates for surgery, or for some reason they didn't want surgery. We said, well, okay, we can put some stem cells in there and it'll help. And it did help. It helped a lot, actually, more than we expected. So I eventually got out of orthopedic surgery and started doing regenerative medicine full time with stem cells, PRP, ozone injections, things like that, IVs, trying to just keep people healthy, try to keep them out of the operating suite if I can.